Ever wondered why you might feel a sudden painful urge to urinate? You might be experiencing a condition known as cystitis. Cystitis, to put it simply, is an inflammation of the bladder. Now you might be thinking, inflammation? That sounds serious. But don't worry, it's a common condition that many people experience at least once in their lifetime. Typically, cystitis is caused by a urinary tract infection, often referred to as a UTI. You see, our urinary system is designed to keep out microscopic invaders. However, sometimes these defenses fail and bacteria can sneak in, causing an infection. When this infection takes up residence in your bladder, it can cause the lining to become inflamed. And that's when we start talking about cystitis. Remember, cystitis isn't something to be embarrassed about. It's a common condition, and there are treatments available. So now that we know what cystitis is, let's move on to the symptoms. How do you know if you're dealing with cystitis? Here are some common symptoms to look out for. At the top of the list is frequent urination. You might find yourself making more trips to the restroom than usual, and when you get there, you might not produce much urine. Another common symptom is lower abdominal discomfort. This could feel like pressure, tenderness, or even sharp pain in the lower belly area. Now, let's talk about a symptom that's hard to ignore. A burning sensation during urination. It can be quite uncomfortable and is a telltale sign of cystitis. Remember, these symptoms can vary in severity from person to person, so even if your symptoms seem mild, don't dismiss them. It's important to consult a healthcare provider if you're experiencing any of these symptoms. They can provide a proper diagnosis and guide you towards the right treatment. Recognizing these symptoms is key to getting timely treatment. But what exactly causes cystitis in the first place? Cystitis can be caused by a variety of factors, but the most common culprit is a type of bacteria called E. coli. This bacteria often enters the urinary tract through the urethra and multiplies in the bladder, leading to inflammation and the uncomfortable symptoms associated with cystitis. Certain medications and irritants like harsh soaps or bubble baths can also contribute to the development of cystitis by disrupting the natural flora of the urinary tract. Now let's pivot to treatments. For bacterial cystitis, antibiotics are generally prescribed to kill the offending bacteria. Over-the-counter pain relievers can help soothe the discomfort and inflammation. In addition, home remedies like drinking plenty of water can help flush out the bacteria from your system. It's also important to avoid irritants that may have contributed to the condition in the first place. By understanding the causes and treatments for cystitis, you can take control of your health and prevent future flare-ups. To wrap it up, cystitis is an inflammation of the bladder, often caused by a urinary tract infection. Let's not forget the symptoms we've discussed, the potential causes, and the treatment options available. Remember, if you're experiencing any symptoms of cystitis, it's important to consult a healthcare provider. Stay informed and stay healthy.